Hi, welcome to our paste bottle feeding demonstration. In this video, we'll show you how to properly paste feed a baby at the bottle. What is paste feeding? First, let's talk about why we would even feed babies this way, and then we'll demonstrate for you what it looks like. If you think about what does it look like to feed a baby a bottle, most people have a vision in their head that looks something like this. The baby's reclined, the bottle is upright, and gravity is doing most of the work to pour this milk right into the baby's mouth. Paste bottle feeding is going to look very different from that. And sometimes different feels strange, but in this case, trust me, different is good, and it will help keep your breastfeeding goals on track if you are going back and forth from breast to bottle. And it will also help keep your baby from being overfed and uncomfortable if you're just an exclusive bottle feeder. So with paste bottle feeding, we have the baby in a much more upright position with the bottle horizontal to the baby's mouth. So let's talk about that. And I'm going to get us ready. We don't want to dribble milk all over our baby, so let's clean this up and get ready to show you how to properly hold the baby and properly hold the bottle. First, let's hold our baby. So again, we're not reclining the baby. We're keeping the baby elevated in a much more upright position. It's important, especially if this is a little newborn, a little baby without much head control, that we use our hand to support the back of the baby's head. So rather than cradle the baby like this, which if you do this, their head will probably flop forward like that. Support the back of the baby's head with your hand. I've got my fingers, thumb and forefinger, sort of right below where this baby's ear line would be. And then if you are in a chair or a couch, support yourself too. I'm using the armrest, but if I was on a sofa, I might prop some pillows up here. Because a paste bottle feeding takes a while. It's supposed to be slow. And so you don't want your arm hanging out here, getting tired. The other thing, we don't want the baby hanging out. So we would never hold the baby on the edge of our lap. Snug him in nice and close to you. We want this baby to feel safe and secure. And if you're the parent doing this paste bottle feeding, you may even want to do this skin to skin. It makes it a nice bonding experience and gets some oxytocin flowing while you're feeding your baby. So if you are skin to skin, make sure they're nice and tucked up and snug with your body. So now we have our baby positioned properly. Let's start this feeding. So here we have our bottle. And what I'm not going to do is I'm not going to just jam this straight into the baby's mouth. Instead, I'm going to bring the nipple of the bottle up to the baby's upper lip and bottom nose and just kind of tickle around that area. What I'm doing here is trying to stimulate this baby's rooting reflex. The whole purpose of paste bottle feeding is to mimic the way babies feed at the breast. And so if this baby was coming to the breast, we'd probably tickle his upper lip and nose with the nipple and try to get him rooting. That's my impression of a rooting baby. I hope you liked it. So once this baby starts rooting around, we allow him to take the nipple into his mouth and begin sucking. So this baby might take 1, 2, 3 sucks, and I will slowly lift the bottle up horizontally to allow the milk to fill the nipple. What about swallowing air? That's always the first question that people ask after we let them know, yes, the baby will begin sucking on an empty nipple. Just to allay some fears here, this baby will not be swallowing so much air that their tummies will explode, that they'll be in terrible distress. We know that anytime babies swallow food, whether it's from a bottle or directly from the breast, when they swallow a little bit of air as well. So even breastfed babies need to be stopped and burped frequently to get out any air bubbles. We're going to apply the same concept in this bottle feeding. So if he began to suck at the nipple, he's not swallowing so much air that it's detrimental, but what he's doing is again recreating the way that he would eat at the breast. So when the baby comes to the breast, they have to begin sucking vigorously to get the milk to let down so that they can begin eating. We want this baby to eat the same way from the bottle so that he begins sucking and then is rewarded with the letdown of milk. This will keep babies working at the breast. By not allowing him to do this for a brand new baby that's not very familiar with breastfeeding, he may struggle the next time he comes back to the breast. It may feel like hard work to have to begin sucking and wait patiently for the payoff. So we're trying to keep it the same. Let him suck, suck, suck. And now we've brought this up. And if I were now to let him begin sucking, if I were to remove the bottle from the baby's mouth, the milk will stay in the nipple. Gravity is not pulling it out of the bottle because of the way that it is horizontal with the baby. Instead, it's the baby that's doing the work to pull the milk out of this nipple. If your baby is very hungry and begins to suck so fast and vigorous, you can slow him down by tilting the bottle back down. It allows the milk flow to slow down to a trickle. He'll stop. He'll pace himself, and once he begins to suck at a slower pace, we can bring it back up. And so throughout the feed, we're going to pay attention to the amount of milk that's in the nipple, to how fast the baby's eating, and to how he's pacing himself. And ideally, we will notice this baby does begin to pace himself. We might witness a suck, suck, swallow, suck, suck, swallow, and then maybe he'll rest, pause. Because the baby is the one controlling how much milk comes in and out of this bottle, he can take a break. He can pause, he can stay latched to the bottle, he can slow down. And that's the ultimate goal here with pace bottle feeding. This baby is drinking slowly, at a slow pace, at a way that simulates the way he eats at the breast. So we'll watch this flow, we'll pay attention to how much the baby's eating, we'll notice if he's going too fast, we can always slow him down and let him start again. About halfway through this feeding, it's a good idea to pause. We'll set the bottle aside and burp him. So we'll just pretend like this baby needs a good burp. Give him a second. Maybe pat his back a little bit. Try again. This pause, this burp break, allows us to do a couple of things. First, it does allow us to move any air bubbles out of his tummy. If he swallowed a little bit of air, we'll give him a good chance to burp. We'll offer several opportunities to move that gas out and make sure he doesn't have any air bubbles trapped in his tummy. This pause also allows us a chance to let the food settle in the baby's tummy and let his tummy send the signal to his brain, I'm full or I'm still hungry. But the way we traditionally fed babies like this allowed them to eat very quickly. And when we eat very quickly, we tend to overeat. So babies would eat a whole bottle very quickly, and then only after the feed would they be allowed to pause and then realize, "Ooh, I'm so full, my tummy hurts." This pause halfway through or 3/4 of the way through allows the baby to figure out, am I still hungry? Do I want to eat more? So we give them that chance. So now we've gotten a few good burps out, we've let him pause, and now we can reintroduce the bottle to see if he's interested in the remaining amount. And we're going to do it the same way. We're going to bring it up slowly, tickle his upper lip, tickle his nose. And let's see, does he begin rooting again? That shows us he's hungry. Or does he do this? Have you ever seen a baby close their lips really tight and move their head away from the bottle? That's a sign that he's full and does not want to eat anymore. And if that's the case, we're going to call this bottle feeding finished. One other final note about paste feeding that I think is especially important: if you are paste feeding an exclusively bottle-fed baby, meaning this baby never comes to the breast to eat, all their food is given by bottle, I think it's really important that we switch them from side to side. So we tend to always do things with our handedness. I am right-handed, so I like to hold the baby in my left hand and the bottle in my right hand. But by switching, and we can either do this at the next feed, we could do a feed on this side, or after we did that pause to allow the baby to let his stomach settle, burp a little bit, we could then restart the feeding on the opposite side. But the point of doing this is to make sure that this baby's eye coordination, motor skills development, his body movement is all being exercised on both sides. Because with a breastfed baby, they frequently go back and forth. But a bottle-fed baby sometimes tends to only be fed on one side. So if we remember to switch, we give this bottle-fed baby the same sorts of exercise that a breastfed baby would get. And those are our important points for pace feeding. Remember the goal here: a slow flow, a pace that suits the baby's needs, allows him to pause frequently, not eat too fast, and simulates what it's like to eat at the breast.